Welcome to today's episode, and I'm so glad you're here. If you've ever experienced jaw pain, heard clicking sounds when you chew, or found it difficult to open your mouth fully, you're definitely not alone. These symptoms affect millions of people, and they're often signs of something called TMJ disorder. Today, we're going to dive deep into what TMJ disorder really is, explore the symptoms you should watch for, understand what causes this condition, and most importantly, discover how chiropractic care can offer effective treatment options. Let me start with a story that might sound familiar. Just last week, a patient came into our clinic describing how she couldn't enjoy her morning coffee anymore because opening her mouth to take a sip caused sharp pain in her jaw. She'd been dealing with clicking sounds for months, thinking it would just go away on its own. Sound familiar? This is exactly the kind of experience that brings many people to seek answers about TMJ disorder. So what exactly is TMJ disorder? TMJ stands for temporomandibular joint, which is essentially the hinge that connects your jaw to your skull. Think about this for a moment. You use this joint every time you speak, chew, yawn, or even smile. It's one of the most frequently used joints in your entire body. When this joint isn't functioning properly, it creates what we call TMJ disorder, or TMD, temporomandibular dysfunction. Now let's talk about the symptoms, because recognizing them early can make a huge difference in your treatment success. The most obvious symptom is jaw pain, but TMJ disorder often presents itself in ways you might not expect. Many people experience clicking or popping sounds when they open and close their mouth. Others find that their jaw locks up, either in the open or closed position, which can be pretty frightening when it first happens. What's interesting is that TMJ disorder doesn't just affect your jaw. You might experience headaches that seem to come out of nowhere, especially in the morning. Some people develop ear pain or even a feeling of fullness in their ears, almost like when you're on an airplane. Facial pain, particularly around the cheek area, is another common complaint. Some patients even tell me they have tooth pain. But when they visit their dentist, there's nothing wrong with their teeth. Here's the key point. These symptoms often develop gradually, which is why many people dismiss them initially. They think the clicking will stop or the pain will resolve on its own. Unfortunately, TMJ disorder typically gets worse over time without proper treatment. So what causes this condition? There are actually several factors that can contribute to TMJ disorder. Stress is a major culprit, and here's why. When we're stressed, we tend to clench our jaw or grind our teeth, often without even realizing it. This puts tremendous pressure on the temporomandibular joint. Many people do this at night while sleeping, waking up with a sore jaw, and not understanding why. Trauma is another significant cause. This could be from a car accident, a sports injury, or even something as simple as opening your mouth too wide at the dentist's office. The joint can become misaligned, leading to ongoing dysfunction. Consider this. Your posture plays a crucial role too. If you spend hours hunched over a computer or looking down at your phone, you're creating tension in your neck and jaw muscles. This forward head posture puts additional strain on the TMJ, contributing to dysfunction over time. Arthritis can also affect the temporomandibular joint, just like any other joint in your body. Additionally, some people are born with structural abnormalities in their jaw that predispose them to TMJ problems later in life. Now here's where chiropractic care comes into play, and this is really exciting. Many people don't realize that chiropractors are uniquely positioned to treat TMJ disorder because we understand the intricate relationship between your spine, your posture, and your jaw function. Chiropractic treatment for TMJ disorder typically involves several approaches. First, we perform gentle adjustments to realign the jaw joint itself. These adjustments are much more subtle than what you might expect. We're working with a delicate structure, after all. The goal is to restore proper movement and reduce inflammation in the joint. What's particularly effective is addressing the underlying postural issues that often contribute to TMJ disorder. By correcting misalignments in your cervical spine, that's your neck area, we can reduce the tension and stress being placed on your jaw. Remember, everything in your body is connected. Soft tissue therapy is another crucial component. We work on releasing tension in the muscles around your jaw, neck, and shoulders. This might include massage techniques, trigger point therapy, or other manual therapies designed to improve muscle function and reduce pain. Education is also a vital part of our treatment approach. We teach patients exercises they can do at home to strengthen and stretch the appropriate muscles. We also discuss lifestyle modifications, like stress management techniques and ergonomic improvements to their workspace. Many patients are surprised to learn that their TMJ symptoms can improve significantly with conservative chiropractic care. Unlike some treatment approaches that might involve surgery or long-term medication use, chiropractic care addresses the root causes of the problem naturally. The timeline for improvement varies from person to person, but many patients start noticing changes within the first few weeks of treatment. Some experience immediate relief after their first adjustment, while others see gradual improvement over several sessions. If you're dealing with jaw pain, clicking sounds, or any of the other symptoms we've discussed today, don't wait for them to get worse. TMJ disorder is very treatable, especially when addressed early. At East Coast Injury Clinic, we specialize in helping patients overcome TMJ disorder using safe, effective, non-invasive chiropractic techniques. I'd encourage you to visit our website to learn more about our specific approach to TMJ treatment, or give us a call to schedule a consultation. Remember, you don't have to live with jaw pain or dysfunction. There are answers and there are solutions. Thanks for listening, and I'll see you next time.